Great. Thank you, Dr. Wilkins. I'm looking forward to talking with this group. I will share a little bit about my NCAA background as it's relevant to this talk. I really enjoyed actually even putting these slides together. I don't do a lot of work in dance or classical music. And so, I did dig into a bit of that literature as well to kind of see what was available. And it was also really interesting to see what's happening in the performing arts. I do have a background in kinesiology and then licensed as a clinical psychologist, actually at Loyola. So I was local. I'm actually currently, so excuse my surroundings, I'm in a hotel room in Miami, Florida, where I'm actually with the US sailing team for a couple days doing performance work with them. So hopefully my Wi-Fi ends up being all right and I have no challenges there. In my work, I ended up doing kind of more, I guess, having more conversations with those at the NCAA. And eventually, actually, there's a committee within the NCAA, for those who just don't know the structure of it. There is a committee that does all of the safety and medical aspects of that work. It's a diverse committee representing all three divisions, so 440,000 student athletes that participate in college sport, and they make the kind of safety and medical decisions that you might see around concussion, right around heat stress. I mean, kind of all the medical and safety decisions and rules kind of come through that committee. They realized that mental health was a significant issue, and they did not have a psychologist sitting on that committee. They had a consultant, but nobody with any voting power sitting on that committee. And so because of my, I think, work with them for a while, I was nominated and ended up being the first psychologist to sit on that committee. With also, a dietitian, also an athletic trainer. So there were actually a number of athletic trainers that sat on that. And then, of course, there were a number of different team physicians representing a lot of different areas, certainly orthopedics and primary care, sports medicine. There was also an attorney on the committee who had a vote. So really a diverse committee that was looking at medical decisions. It was an active time. I think that's why they created that position. And I ended up being very active on the committee because so many of the legislative kind of things that were coming down the pipeline had to do with mental health. It was the same time that we were having the mental health best practice task force that was created. We had that task force. We went into a sleep task force. We had a diverse student athlete task force. So a number of different task force that bring in experts from all areas to create some guidelines on how to, best treat, best practices within, managing just student athlete care. There was just a lot of focus on the mental health aspects. Ended up being the chair of that committee, I think, because I talk so much. And, that was a really neat experience for me, also to really understand what was going on in the NCAA. And then, of course, in March 2020, while I was the chair, our sport world came crashing down and we canceled college sport for all of our student athletes. So, and that had a significant impact on mental health for sure. So I certainly appreciate Dr. Wilkins' kind of conversation around it. This has become a much louder conversation. I'm sure those of you who have been working in this field for a while have noticed the changes. And I hear about it quite a bit, I think, because I'm a psychologist, right? And people will often share kind of their experiences of working with adolescents currently. I'm going to go ahead and go into my presentation. I'll give my little disclaimer, and that is, so I'm at the Naval Academy. None of what I says, what I say is for me, not the Naval Academy. So it's my little disclaimer there. So I don't have a slide on this, but I just, to kind of give you an idea, in the last, I think it's, 8 years, pediatric increases in mental health and ERs has doubled. Right, and those pediatric patients are certainly now adolescents and are going to be college student athletes, and they're going to be dancers, performing artists, musicians, and so we're really seeing this at the kind of beginning stages. I mean, we have 5-year-olds, 8-year-olds with severe mental health and thoughts of ending their lives. And that's going to come to all of us, right, as we continue to do this work. I'm going to define a little bit. I just like to get people to understand student athletes, and so I'm going to talk about that specifically. Really quickly about just this this generation, I could spend a whole presentation just on this. So I'm just gonna, but I want to frame it so you know who I'm talking about, who we're talking about. So this is considered the iGen. This is the years that they were born. If you're curious kind of where you are, so if you're a Gen Xer, right, you're 1961 to 1980, millennials out there, you're 1980 to 1995, millennials, you got all kinds of awful things said about you. I still love you. There's all kinds of wonderful things, right, about every single generation. And that's actually why I'm talking about this, is because different generations bring diversity of thought, different experiences, they push limits, and this generation is going to do the same thing. What we're seeing, though, is just a massive change in the way in which they spend their time. And that has to do with the phone, right? This group has had their phones, right, since the beginning, and that is different than all the other generations. So I don't have the name of this researcher up here. Her name's Judy Twenge. This is from her work. There's a lot of kind of data around this. So this is generally what we're seeing in this generation. You know, it's an interesting time because in many ways, this is the kind of summary of this is they are the safest generation we've had in a long time in terms of physical safety. So they are not physically taking risks. In fact, they're often in their homes, in their bedroom, you know, and even though they're at their homes and potentially in their bedrooms, they're actually less close with their families. So the way in which they're spending their times is just so vastly different. And interestingly enough, you know, if you dig into this literature quite a bit, that you'll also notice, right, it's not their fault that this is happening, right? It's often actually the parents' challenges and the reasons that they're kind of acting in this way, because we can, of course, now track our children everywhere they go. But you can see this dynamic. It's really led to what a lot of people think is psychological vulnerability because they are taking risks physically. They're not pushing limits in some ways, and that has, you know, can increase likelihood for mental health challenges. I'd be happy to come back to this slide, you know, if there's any questions. So when we start talking about mental health, like this is definitely on a continuum, right? This is not just, it's not black and white. There's so much gray in this, you know, in our mental health, it can shift, you know, moment to moment, right? You know, in my world, certainly working in a college student population, somebody has a bad test, right? Somebody has a significant other break up with them, right? They have a bad interaction with a peer, right? You kind of can see this kind of quick shift, a little downwards, right, into kind of more, you know, mental illness. On the same side, right, they have these outcomes, often situational dynamics that can also then kind of push them towards more resilience and thriving. We're constantly up and down on this continuum. And I think it's good to understand this, that, you know, today my focus is a little more on the mental health disorder side, right, looking at the mental health problems that exist. But I just want people to understand that, like, this is really a continuum. It's always shifting, and it's kind of how we see it. So this is data from the National Collegiate Health Association. They do pretty good collection of data pretty frequently. All this one's a little bit old, but you know, this is looking at obviously our student athlete in a college population. It doesn't define what division they're in, and also right then versus a non-athlete. And what we're seeing, right, in depression, right, which is, have you ever felt so depressed that it was difficult to function? We're seeing pretty high numbers, right, across both populations. There's a little bit less population, it's not significant, but it is a little bit less, right, amongst our student athlete population. Athletics, and I'm going to get to this in terms of also performing arts here. You know, athletics and performing arts have often, or participation in sport and participation in performing arts have often been considered a protective factor. It's something that keeps us healthy because we get to engage in something that's purposeful and meaningful. And yet we're now kind of seeing this pendulum swing a little bit, where maybe it's not protective anymore in some regards. And yeah, we're certainly seeing some changes here. This is a slide that really gets more at anxiety. right? And, again, this is dividing up a lot of the sports. This is, Division 1, 2, and 3. You can see really a change among sports here, and what we're seeing in terms of mental health. So again, just the numbers are pretty high. And, difficulties were piling up so high that you could not overcome them. It's a pretty overwhelming feeling, right? So this is really being overwhelmed. We're and a lot of these, right, which is true for both performing arts, I think, and certainly within athletics, is that the time demands that student athletes are feeling really may be part of this experience. And in fact, actually, when I get to the tools section of this, I'm going to talk a little bit about sleep, because that has a massive impact on mental health and well-being. And when you're feeling so overwhelmed that you can't get everything done, one of the first things people do is they start sacrificing sleep to manage the experience. This is looking at student fatalities, and this is an NCAA, and what actually you're going to see as well is this is true actually amongst most actually just college age, the population. It is those who are in college though. In terms of student athlete fatalities, again, this is old data. There's not yet a new one of these. It'll be coming out hopefully soon. That suicide is the second leading death. If you look at these, though, obviously drug overdose is in there as well, 2%, right? We'd probably put that in the mental health world as well. So we're looking at a pretty high level, right, of death, for mental health concerns. And this is going to lead me into a little bit about, so the performing arts. I focused a little bit here on athletics. A lot of words on this slide. Sorry, there are a lot of words here, but so. And all my citations are on my last slide as well, just so you know. But classical musicians face increased risk for mental health issues compared to the general population. Was found in one study, in a recent study. If you look at dancers, you see a lot of perfectionistic tendencies in one study, right? The number is as high as 79% of perfectionistic tendencies, right? We typically know that perfectionistic tendencies will lead to things like, anxiety, disordered eating. Another study, comparing athletes to dancers, is that, if we look at like the background, who is coming in, right, to our offices, there's a lot more childhood trauma, anxiety, and emotional difficulties. And when we look at that childhood trauma, actually that continues, it seems like actually for dancers. Again, this is one study looking at this. I think it was interesting, right? Those who actually who needed surgery had more cumulative trauma as children. I think that's really fascinating and important to consider. And again, both dancers and athletes have increased exposure to childhood and adult traumatic events, and that was associated with injury. So, who you're seeing, right, in your offices as adolescents who have injuries, right, from these experiences, they may be already at higher risk for mental health concerns, and that's I don't think it's surprising, right, to most of us. We see, physical and mental health, they are absolutely, they go together. You can't separate them out, right? The second you have kind of a psychological health challenge, right, you're now seeing somebody who's absolutely more vulnerable to physical injury. And I know that those are certainly the conversations Dr. Wilkins and I've had. It's really a challenge. I'm going to talk specifically about suicide, and the reason I want to talk about this, well, obviously you saw it's the second leading cause of death for student athletes, and again I'm going to get another slide here in a moment that's going to also say, just generally speaking, college age individuals, it's second leading cause of death. It's an area that sometimes people feel uncomfortable assessing. In my work with athletic trainers and doctors, and and all different types of specialty areas, it can be uncomfortable to ask the question about, are you thinking, or are you having thoughts of ending your life? And it's such an important question to ask. And so I just want to give some kind of data behind it. I think people often don't think people are thinking that, and yet our numbers suggest a little differently. So okay, suicide, right? So here's my slide. It is the second leading cause of death among youth attending colleges, right? So it's not just among athletic population, but generally speaking, second leading cause of death. accidents is still the top number. We often see external events precede serious consideration of suicide. Not all the time, but we can often see something happens. There was several student athletes, women student athletes, who ended their life by suicide in the spring. Those of you working in athletics are probably aware of it. There was a woman from Wisconsin, a woman from James Madison, and a woman from Stanford. And it was kind of back to back to back. I know for me working in sport, I became very nervous and worried about certainly specifically my female student athletes and kind of what they were thinking and feeling. And you can actually see within within suicide, actually you can see copycat behavior. In fact, actually, if you pay attention to media, one of the things that media is very well trained in is they're not supposed to reveal the method of suicide. You can say that they ended their life by suicide, but you don't say the method. And that's because you can see people actually engage in that method and kind of copy that experience. But so it became very scary. And as more information has come out, at least with one of those student athletes, it's been pretty clear there was a specific situation that there was, potentially a lot of shame in for her, and that that may have been the kind of cause of what happened. I don't know, right? Who ultimately knows? But there are certainly, when there's serious events that occur, that kind of gives you a little more, information. And look, I think, interest in checking in. Certainly, one of those things that can be a serious event for a performing artist or an athlete is an injury. Like that definitely qualifies as an external event that can be devastating to the population you're working with. We know suicidal ideation is an important marker for risk of suicide, but so the number is, right, for every 1,000 who have a thought of suicidal ideation, a thought of death or a thought of ending their life, 1 will complete suicide. And I don't know if you can hear my language. I try to be pretty careful with this. The language has changed. We don't say now committed suicide, because committing to something is usually considered kind of positive and good. So we try to use the language of, ended their life by suicide. So it's the method by which they ended their life, died by suicide is the language. We see 3 factors most associated. Actually, this is David Jobs, research out of American University and Catholic University. He's down there and has a great lab there that looks at a lot of these factors. And these 3 factors seem to be they're common amongst all suicides. If you look at these, right, there are ways in which I think performing artists and athletes in particular, right, have opportunities to either not feel like a burden because, right, they're part of a team, they're part of a performing group, right, so they feel like they're kind of connected and belong, but, right, when they are potentially pulled from that experience now, right, an injured athlete, an injured musician, right, I think an injured dancer has kind of increased likelihood to feel like they might be a burden and that they don't belong. And because of their experience potentially, right, within their specific domain, they may have high levels of tolerance of physical pain. And we tend to see that with those who end their life by suicide, is, right, they're willing to tolerate the discomfort of ending their lives. So those are the 3 factors. So again, just kind of, I share this with you because of because of your expertise, what people are coming in to see you for. Okay. So there's been a lot of really wonderful work in this area. In particular, the University of Michigan paired up with, they have a center for, it's not called the Center for Depression, but it's something to that effect. And they had a pretty large NCAA grant to create content. And what they did is they worked with their mental health providers, their sports medicine physicians, right, athletic trainers. They really kind of combined resources and created these videos. I wanted to share this video because I think it gives an idea of kind of, when we look at student athletes specifically, and this could certainly be in the performing arts as well, when we look at this population, sometimes the necessary resources are mental health treatment by a provider. Sometimes it's just getting them connected with other resources. And this student athlete, this young man, is going to talk about his experience and what worked for him. But the idea is that there are a lot of different levels of care out there, right? Just as I'm talking to you, right? Some of your athletes, I assume, see an athletic trainer, and that's all that's necessary, and it's all through that, and then others end up needing surgery, and mental health is no different. There are different kind of levels of care when student athletes have access to them that can really be impactful. So I'm going to hope this video worked a little bit ago, so hopefully it's going to work again. And Dennis, if it's all right, if it's not working, will you just let me know?
When I started at the University of Michigan, I had extremely high expectations for myself. Then, right before my freshman year, my mother passed away. I struggled dealing with grief over her death, not to mention living in a new environment with increased athletic and academic demands. I consistently found myself alone, spiraling downward. Eventually, it occurred to me that isolating myself was doing nothing to better my situation. I made changes. Mental health works very similarly to physical health. When we ignore our physical health, our fitness levels are reduced and our bodies suffer. We become weaker, more susceptible to illness, and are slower to recover from injuries. The same is true of our minds. When we neglect our mental health, our moods can fluctuate rapidly, memory and cognition can become impaired, and our worldviews can begin to have a negative scope. On the other hand, when we work on our minds the way that we do on our bodies, it can have a tremendous positive impact on our quality of life and the ability to achieve our goals. We can improve our well-being by caring for our minds and our bodies. I began to talk with my teammates and coaches more often. I attended Athletes Connected wellness groups to learn skills and strengthen my mind. I made friends outside of my team and took time for myself when I needed it. Fast forward a few years, and school, gymnastics, and life were going great. Training my mind helped me to stay on track through adversity and played a huge role in becoming an All-American and a national champion. My key to success in those areas of life? Attention to my mental health. I learned that in order to be successful externally, I had to be successful internally. My new outlook made me a more resilient, capable student athlete. There are lots of forms of mental health support. For me, talking with friends and learning mental skills like meditation were enough to get me through the hard times. For others, professional support from a counselor, therapist, or doctor may be a better fit. We all fall somewhere on the continuum of well-being, and we fluctuate within it depending on our life events, accomplishments, stressors, and so on. Remember, you don't have to be sick in order to get better.
Your mental health is just as important as your physical health.
Don't suffer in silence. Our doors are always open.
Okay, so that's the video. I think he does a nice job of really talking about, right, like kind of what led him to his challenges. Certainly, a traumatic event in his life, not quite fitting in, even though he's part of a team. And with kind of small interventions, he gets better. He recognized it quickly. and was able to get help. And it seemed like it made a significant difference. I don't think everybody has these types of resources at their fingertips, especially those, in your kind of different kind of areas. I think if I don't exactly know, but I can imagine like if you're in private practice, right, you don't have like a mental skills group to send the athletes that you're working with. And so that kind of leads me to my next slide, which is really around, there we go, understanding your resources. So I do think kind of in anybody's area, wherever they are, it's important to understand what are the resources you have. What are the strengths that your practice, right, that your kind of relationships in your community, how does that promote mental health? What are those resources you can get people to? What are the challenges that you might face based on the community or kind of practice that you're in? If you consult with, a college or university, I think it'd be really wonderful to know, what are those challenges that or high school, sorry, or any kind of, community that you're consulting with, what are the challenges that they're facing as well? What are the resources they have? Also I think about so strengths and challenges tend to be a little more internal, right? Opportunities and threats tend to be a little more external. So, what are the opportunities that are coming online? We actually now have a lot of opportunities in terms of, and I'm going to get to these things like online resources. It is a, massive area of growth. You can actually, be working with a student athlete, tell them to, pull out their phone and download an app. And while I'm going to talk about potentially the negative aspect of phones, there's some wonderful resources on phones that have really been developed, and I'll share a couple of those with you. And then what are the biggest threats, right, that you may see in terms of well-being in the groups that you're working with or the community that's there? I think it's important to think about all of these. So we're going to talk a little bit now about like how to identify, and I'm going to go through a couple different ways to think about this. Look at my time. Yeah. So I'm going to go through kind of what we tend to see, right, in a student athlete population, right, and then I'm going to talk about some objective ways to measure it. More just kind of subjective ways. So what do we see, right? We see changes in performance. And I think actually athletics and probably the performing arts gives us a really nice opportunity to like notice what are those changes in performance, right? It's a question you can ask, right? Do you feel like your performance has changed at all, since you've experienced this injury and, in other ways, right? You're looking for unusual patterns of interaction, right? Things that are different, right? Which again, you may have to ask them about this because you may not see them like in their kind of natural environment. You may see, all these requests for kind of special consideration. And lastly, right, you'll see kind of exaggerated emotional responses. Those are kind of some, I think, obvious things that you can kind of notice or ask about in your students' adolescence experience. Other common experiences we tend to see, a lot of worry or fear. I do think in this generation, we're seeing just such an incredibly high level of worry. It's palpable in terms of what they're experiencing. Certainly excessively feeling sad or low, concentrating, learning, again, mood changes, or strong feelings of anger. While adolescents, girls and boys, right, are very more similar than different. At times they will have different ways of expressing emotion. And the challenge of some of that expression is that girls will more likely feel sadness. And what does sadness do typically to the people around them is it usually brings people in, right? If you see somebody being, if you have a friend who's being tearful or looking sad, right, you might want to go up and, give them a hug, like care for them. For boys, right, a common way that they will express their pain, which is ultimately, right, what both of these are is expressions of pain, they'll express it through anger, right? And if somebody kind of, punches a wall or looks angry, right, how does like that community respond to that? Do they just say, oh, that's normal? Do they kind of walk farther around, right, that boy instead of actually going up and saying, what's wrong? Can I help? And so sometimes in the way in which genders express Emotion, you can have different responses from the community. And we know that whether it's anger or sadness, the person's expressing, you can actually see it's pain. Underneath both of those is pain. And so we want to make sure, right, that we address both of those. And when we see them and they become ineffective. So I think that, yeah, so again, so a couple more things here, right? Avoidance, changes in sleeping habits, eating habits, certainly abuse, I think marijuana is now a massive issue. I will say the NCAA, one of the things I fought for pretty hard, I have no problem saying this to the general group, is that I really fought hard to keep that the testing levels very low. They're right now, in the literature on mental health and marijuana use, it is not good. The psychosis rates are out of this world. I mean, the levels of psychosis, if you probably have colleagues who work in Colorado, potentially, and I do, and they're seeing such incredibly high levels of psychosis due to marijuana, and depression and apathy, and so it's really having a massive impact. That when I got off the committee, the levels changed. Now it's a little higher than it's now with the WADA, the World Anti-Doping Agency. They kind of NCAA levels went the same as our international standards, which I understand, but it does mean people can use and still play sport and not pop positive. Not use a lot, right? But they can use and not get penalized for it. And that's I know it's a long conversation. Probably I don't. Some people probably disagree with me on that one. So hopefully I didn't get too many people upset at me for saying that. But you'll see a lot of physical ailments as well with those, right, who are struggling with mental health. And I think that's where you can really see people if they have a lot of physical ailments. And then, of course, right, if you hear anybody say any thoughts about suicide, right, even if it's like a joke, that's a lot of times, yeah, they will just kind of say and do things that talk about not wanting to be here. And that's an opportunity to ask another question. Let's see here. I think it's really important, and before I get into actually how you screen for this and some objective measures that are out there, I think you really want to make sure you know your resources. If you're screening for this, you want to make sure that you can refer for it. And you could potentially have somebody in your office, if you ask the question, right, are you having thoughts of ending your life? And they say yes, you can't let that person just walk out of your office, right, without a specific referral. So I would want to make sure that you know how do you really access mental health within your communities to make sure that they can get care. I know many communities are struggling in this area with mental health providers. There's just not enough resources right now. But I want you to think about that as a provider, so that you have somebody you can call or refer to pretty quickly. Because when you ask these questions, right, when they say yes, you need to be able to take care of them. I was going to play a little game. I don't think it's going to be possible over Zoom, but I'm just going to describe it to you anyhow. And that is the word "oh." So, we could kind of, and maybe I can ask you guys to do this on your own a little bit, right? So like the simple word "oh" doesn't really say so much, right? As you just see it here, just "oh," right? But when we say the word, it can have a number of different meanings, right? Based on really the nonverbal behavior that's engaged with it. Like, how is it spoken? How are you saying "oh," right? So if I said, right, like, you surprise me, how would you say that "oh," right? Maybe "oh," right? I made a mistake. "Oh, you're a pain in the neck." "Oh," I mean, it's one word, but it can come across in very different ways. And I think a lot of that nonverbal behavior is going to make somebody more likely to actually tell you how they're feeling, right? I've been in rooms where, questions are being asked and, about mental health, serious mental health, and the providers, staring at their computer, right, asking the question. And I think to myself, boy, is that, person going to actually be able to respond, right, with saying yes, right, when there's like not eye contact, right, when there's not nonverbal behavior that says it's all right to say yes, or it's all right to say I'm not feeling well. And so a lot of that, I think, is important to consider. So what are some more ways to screen this? And I know this, I don't think I can kind of ask this question. I'd be curious, obviously, what your own experiences are. I guess as you have some ways already that you're screening this, depending on the clinics that you're working in. I will share, many institutions have a pre-performance physical exam. It's a wonderful place, right, to get access to screening tools. Sorry to ask these questions. I was lucky enough to be with Dr. Wilkins this weekend, and although our experience wasn't necessarily super lucky, but it was a good experience overall in our Army Navy football game. But in particular, he handed me a study, which I am citing here because I think it had a lot of power in terms of this was a community-based pre-performance physical exam in which they added the PHQ. Many of you are probably familiar with the PHQ. This is -A, so it's for adolescents, right? There's the PHQ comes in several different versions. It's a 9, a 3, and they have like different number of questions they ask. It is a mental health screening tool, validated mental health screening tool. It's very face valid, right? So when they answer, they know what they're saying. So there's no tricks about it. And this very large community-based population that they assessed, that was, you didn't have to have like medical care. Essentially, they brought you to a community center on some level, and they had physicians and mental health professionals there to do all the assessments prior to a high school season. They found, right, this is what the numbers they found. And there's no relationship at all, right, with that athlete and whoever was asking those questions. We tend to see usually a little underreporting when there's not a strong relationship there. And still, right, 16.9% had clinically significant depressive symptoms, and in particular, 2.5% had thoughts of death, in which they had to immediately get them to a behavioral health specialist that was sitting there. And actually, they said, the one person went right to a hospital. And that was just a voluntary, pre-performance physical exam that occurred prior to a high school sports season. There are also some other assessment tools. So the PHQ, I see that a lot used frequently in this NCAA population, and not the PHQ-A, usually it's the PHQ-9. And in fact, actually, so the link that I have there, I'm not going to click on it because I just am a little, sorry, I didn't put the actual page in there, but if you go to this link, there is the mental health best practices guidelines are housed under the NCAA website. And there they have a pretty long list of all of the assessment tools that are commonly used on college sports. They're not college sports specific. And there's two tools that I wanted to mention specifically that are relatively new that were developed by the IOC, so International Olympic Committee. They're more for the elite athlete population. But the sport mental health assessment tool, another validated tool, and when looking at more elite athletes, the sport mental health recognition tool is actually used for elite athletes, family, friends, right? So it's a little bit kind of less intensive, but it's actually, specifically for those who are surrounding the athlete. And that really to encourage assessment in these areas. And so screening, I think, is really important. And you can have these objective measures. I don't think they're sufficient. What we found in the NCAA work, if you talk to psychologists, if you hand a student athlete a piece of paper to fill out or just kind of put them on a screen to fill out, they tend to not be very honest. If you sit down with them and ask them the same questions, they tend to answer the questions differently. So, right, we often want some combination of both an objective screening tool, but also to have a human there to provide it. That's hard to do. That takes a lot of resources to make that happen. But we know the numbers really change when you have a human asking the questions versus, a piece of paper there where they just have to circle things. And again, I'll reinforce and then have resources ready to refer. This is also, right, I think this is part of having a conversation. Those of you who get to know your performing artists and, get to know your athletes well, because, you're in a community-based, you're with them somehow. So often we're trying to get people to validate. I think probably being, with all of our education, right, we tend to want to, find a solution. And often this population's not looking for a solution. They just want to be heard. Right. So just being able to say, right, that makes sense. It sounds difficult. I'm so sorry you're struggling now. To be able to appreciate, what the person's telling you. To be able to say things like, you're not alone. I'm here for you. Right. Thank you so much for sharing what you did. Again, will be, helpful in getting them to the right resources. And again, I do want you to refer when necessary. You know, and I want to give you a couple different resources in here too. I'm going to go to assessing a little bit of severity and then some tools, because sometimes it's referral, right? Sometimes I want you, it's going to be, you know, let me get you to talk to somebody, or sometimes it's going to be, I've heard, you know, I know of this app, I know athletes use it and performing artists use it. It can be really helpful, right? Let's talk about your sleep. You know, let me talk about meditation or mindfulness. And kind of the referral doesn't have to be to, you know, another provider. It can just be to a skill or a tool. I think that can be helpful. So I do think severity, right? So how long, you know, if somebody's been feeling this a long time, right? Typically, right, severity is a bit up. How much are we talking about it interfering with your daily activity and daily functioning? I think that that's a really important thing to understand, right? People, it's normal for people to feel sad, right? If you were telling this as well, they just found out they're injured, whew, like it is very normal to feel sad. That is, I think, a very common response, and to feel worried. And so, right, when you do a checkup and you find out though, like they're not going to classes, right? They've pulled away from their friends, or not hanging out with their team at all, right? How much it's interfering with their daily activities. That's when you need to, you know, get a little more serious potentially about a referral. Sadness and worry, very normal. And then also to ask the question, right? Have you had thoughts of ending your life? It's an important question to ask, and we can get treatment for it and get help. Okay, so I'm going to here. So some of these tools, I don't know how many of you have heard of Maslow's hierarchy of needs. It's kind of one of these basic level Psych 101 things that we're taught. Actually, we teach it at the academy, even in our leadership classes. It is a pyramid in which there's this bottom of the pyramid. And so Maslow's hierarchy of needs talks about getting to self-actualization, that there's kind of like stages along this pathway to become self-actualized. And that bottom of the pyramid, like the base of being able to have wellness, right, and to be healthy, is 4 things, right? Sleep, food, hydration, and exercise. So I think that's always a good place to intervene. If somebody begins to say they're sad, right, they're having anxiety, I think I would absolutely, the first question would be, right, how are you sleeping? Because we know sleep is specifically tied, right, to mental health concerns. It's really actually, I mean, they did a study at the University of Arizona with their varsity athletes there. They looked at 7 hours or more, 7 hours or less of sleep, divided them into 2 groups and a number of assessments. Those that slept less than 7 hours had 3 significant differences in mental health. Obviously, they had more physical injuries as well. I shouldn't say obviously, but they had a lot of different physical ailments as well. But in the mental health world, they were more anxious, more depressed, and more disconnected from others. I think that's a very interesting one, right? That you actually can't connect as well to others when you are sleep deprived. I think actually I'm kind of skipping around in this one a little bit, but our phone and devices are causing massive issues with adolescent sleep, massive. If I could prescribe blue light glasses to every single person who has a device, I would. It's one of my first things I say, like people need blue light glasses because they're on devices, and it's really interfering with sleep patterns at night. So some people will even be going to bed at normal hours, so they have quantity of sleep, but their brain waves while sleeping, if they're exposed to blue light right before they fall asleep, are different, and they're not as restful. So, you know, really first assessing this kind of base level before you even get to mental health, because there may be some interventions you can give them in sleep, food, hydration, and exercise to help. I'm a big fan of mindfulness. I'm hoping many of you actually practice it. Mindfulness is a very simple exercise in which it consists of 2 things. 1, present moment focus. 2 is non-judgmental. That's all mindfulness is, right? It is a very simple activity. So there are apps for this, right? I put on here a Headspace, and Headspace right now is probably has the most funding. So they give a ton of content away from free. If you go onto YouTube, right, and put in Headspace into the search bar there's an entire, Headspace has a gigantic channel where there's all kinds of different playlists for meditations. One's on focus and one on like managing grief and all kinds of interesting things. Sleep. They've paired up with Netflix. There's now a TV show that they've done to actually teach really about meditation and mindfulness. And you can actually now on Netflix, there's like an interactive with your remote interface. It's kind of pretty cool. I find a lot of people who have resources will have Netflix, but certainly Headspace is for free out there as well. But mindfulness can be very simple. It's just present moment focus, non-judgmental. People will sometimes say that they don't like it because they get distracted a lot or they're not good at it. But interesting with mindfulness, you can't be good or bad at it. You just are at it, right? Because you're non-judgmental. So sometimes we find that people get distracted a little more often. If that's the case, we want them to do something maybe more active. A common one I will say to people is 5, 4, 3, 2, 1. I was just doing this yesterday with some athletes, and it's very simple. Tell me 5 things you see, 4 things you can touch, 3 things you can hear, 2 you can taste, 1 you can smell. Sometimes it's 2 you can smell, 1 you taste. Those are the harder ones. And when you're engaged in that, the whole idea of this is you're just looking around, right? 5 things I see, right? My computer, my coffee mug, my phone, a piece of paper. As I'm doing that searching, I'm only focused on those things. I'm very present moment focused. Right, I'm not thinking about everything else. And we know if we can just kind of get somebody present moment focused for a while, the brain recovers, brainwaves change a little bit, and it is really helpful. I already addressed sleep. It's a massive issue for this population. I guarantee amongst our performing artists and our athletes, they are not getting enough sleep. It's really a challenge. So I think assessing that and then, being kind to themselves about it. But, I say, can you get 10 minutes more? I'm not saying like, yes, I'd love it if everybody got 8 hours, but that's not going to happen for a lot of populations. But can you get 10 more minutes tonight? Usually people say, yes, I can do that. And maybe even assessing if they have some sleep difficulties, because that will then contribute to mental health concerns. Social media is a massive issue as well for this population. I didn't put any of this data on here, but right, the more you're on social media, the more depressed and anxious you are. Right. There's a great kind of conversation, those of you who are familiar with Simon Sinek, about, the access to social media at young ages. He compares to having a liquor cabinet with no rules on it, right, for a 14-year-old. Right. It is a massive tool to numb yourself out. And if at 14 you learn how to numb yourself out via social media, which most of them are doing, they're learning it very early, that if I just pick this thing up, right, it numbs me out. I don't have to feel, right? Then it doesn't teach us actually how to manage that emotion. And we keep going to that, right, to manage emotion as adults, even, as we get older. Social media is a massive number. And I always ask the question, do you feel better once you put your phone down? And often they say, no. Right, but was the way in which they distracted themselves. One question I always like to ask, it's interesting, many populations, they look at me like, what? I say, like, what do you do for fun? And sometimes they'll look at me like I have, 3 heads. I think it's an important question to ask, because you want people to be engaged in things that also bring them joy. Sometimes it's just their sport or their performing arts, right, that bring them joy. Sometimes that's not sufficient. And I think I'm there. Resources. These are mostly at college age populations. I do think it's interesting to know as well. So the International Olympic Committee, now 2 years ago, created a diploma in mental health for sports medicine physicians. Actually, it's not just physicians, but anybody who works in sports medicine. It's a year-long course. I don't get paid for it at all, but I'm a faculty member of it. So I did the one on anxiety. I think it's really interesting that IOC recognized that they really wanted this education in their, sports medicine teams. So it's there. There's a lot of information right on from NAMI, the National Association of Mental Illness. They're a national organization. They have a lot. I put the college guide on here. They have a lot around adolescence as well. And then NCAA Sports Science has a lot of mental health education resources. And it's interesting, I couldn't find as much for performing artists in terms of kind of, groups that would have this. And my guess is my performing artist friends would probably be able to tell me some of those as well. A lot of this applies. I think they're very similar dynamics. Questions?
Dr. Mohler, that was awesome. Thank you very much. It was a very helpful conversation, even though you were doing all the talking, but I certainly was listening. Thank you very much. I think we are all aware of it, and we probably need to make everyone else more aware of it. But I thank you for all you do for our athletes, and thank you for participating in our grand rounds this morning. But we do have time for questions. So if anyone does have questions, please chime in. no one has one. I do. One of the things that I hang around coaches, and they've watched the generations of athletes come through, and some of the people are old school. I'm probably in that mindset. But how do you develop mental toughness without stepping over the line of being doing some of the old things we used to do when athletes made a mistake? Go run a lap, fumble the football, do 10 push-ups for a fumble. How do you develop mental toughness and still not push them over into anxiety and other things?
Yeah. So great question. And I think it comes from being able, right, to hold somebody accountable, right? So that's not at all what we're suggesting anyway with this population. We want them to have high standards and be able to hold them accountable. It's the way in which you react to when they don't meet that standard, to understand, right, when somebody's not going to meet a standard, that's going to happen. People are going to make mistakes. And the way in which you manage that situation, we know punishment actually doesn't work. It's actually not good for performance. And the data is there quite strongly. So if you punish somebody for making a mistake, what they're more likely to do is take less risk. Versus somebody make a mistake, right? You notice the mistake and you hold them accountable, right? You say like, that was not good enough. But you also show care and concern for them. And you really are able to show, right, I care for you, and this is why I want you to be able to do it better, versus a punishment process. Because punishment just, it pulls people back. I mean, if you watch even like, youth sport, and, you have a, like, a 14-year-old soccer player, right? And they, the team has all these great passes, right? They get the ball down to the end of the, close to the goal, and the athlete takes a shot and the shot is wide, right? And what happens to the crowd? Like, oh, right, that goalie, that coach has an opportunity to respond at that moment, right, to that student athlete. They can pull them off and punish them and say, why did you take that shot? How did you make that mistake? And what's going to happen the next time that athlete is in that position? They're not going to take the shot, right? They're going to be nervous about taking it, right? And what we actually want shooters to do, we want shooters to take shots, right? So, it's different if, right, the coach pulls her over and says, hey, like, looks like you went a little wide there, right? Like, I have faith in you. I have trust that, like, you can manage to do this, correct the behavior. If there's something you can say to do, right? And say, go get them, right? And put them back in, right? The way in which we react, it's not saying to be kind of gentler on some level, right? But it's about giving instruction and sharing that you care. And because the relationship is so important amongst all of us as humans. Certainly coaching and an athlete's relationship is really critical, and ultimately that athlete will be willing to sacrifice so much more and take many more risks in positive ways if they have a close relationship to that coach. I don't know if that helps answer that.
Thank you.
Hi, Jess. It's Andrea Lassner. I head up the clinic for performing artists at Peabody Institute, and I just want to applaud you for all the work that you've done. And going into now performing arts, it's there, but it's not well studied. So any resources that you could pass along to Dr. Wilkins to get to me. We've just now recently posted an embedded counselor position because our students were seeing so much. And so when you were talking about the similarities, the musician side is actually quite different because they're so isolated. So even though they work maybe in an orchestra, they are very secluded. So not until maybe they come to me, in rehab, that those sorts of things come out. But in the dance population, it definitely, there's a added pulse for sure. I guess in terms of the different questionnaires that there are out there, I would love to know, because I feel like this past semester we had the most severe injuries that we've seen in the 4 years that I've been there, like leading to injury or leading to surgery, I should say. And they all seem fatigued and tired, but I guess how would it go if I tried to do a little bit more digging in with, like, could we do a questionnaire and use that to get a pulse on the students. But if we don't have a resource in place, like right away, is that going to be detrimental, or could that maybe accelerate things? I guess, what's your thoughts on that?
Yeah, so I do think you could use an objective measure. Yeah, I appreciate your perspective, and I will do a little more digging. I have a colleague who I didn't connect with before this, but does work in dance, and yeah, I did get a little more kind of specific information around resources. But the PHQ-9 is something that would be very, I think, relatively easy to administer. It is made for administration by, a sports medicine team. We know that the validity of it will go up if you actually ask the questions and then like kind of score it for them, if that makes sense. A Likert scale, I think it's 1 to 5, right? How much do you feel this way? You'll get more honest answers if you ask them in a kind of before the season or before kind of your, I don't know, academic year starts. I don't know exactly when like the kind of start of it is, but you do need referrals, because you absolutely, if you ask these questions, you're going to get positive responses. It's a weird dynamic, right? Do you not ask because you don't have a place to send them? And do institutions do that all the time? In all different types of areas, isn't just mental health, also physical health. But yeah, I think you'd want to have it sounds like you have somebody there who you could potentially refer to. Sometimes what you do, what I would recommend to some institutions do this, is they kind of have a day that they're going to ask these questions. And so they ask the behavioral health provider, hey, can you please be available today for kind of walk-ins, just having one day. If you do kind of all your screening potentially on one day, I don't know if that's possible or not, that then you can then say, okay, if there's a kind of a positive that needs, and PHQ-9 is like a score, and it says, okay, like this is where you'd want to refer over for, you have access immediate to some, behavioral health clinician that can do an assessment about kind of how serious the challenge is and whether, what kind of treatment plan. But that's how institutions will do it. They'll kind of just have a behavioral health provider just that day kind of on call and available. I do think the PHQ is like one of the easiest ones. I do know in dance, we obviously see a lot of disordered eating as well. And so there's some great tools that you can ask. The website that I provided, I don't know, Dennis, did they get the slides or do they?
I can send them to them, or they're going to be posted. Sure.
Okay. When they're posted, then yeah, you look at the link that I gave the NCAA, that is, and there's a list of like 10, I think, different questionnaires. They are not sport specific. They're just general screening questionnaires that can be used for any population. So you could also, there's a disordered eating one that's on there. I think it's the Eat 26, that again are pretty short. And we know they'll be more honest if you're there present with them answering it. But again, sometimes people just can't. So they just kind of hand out the paperwork and then paperwork and review them. The challenge is somebody kind of pops, of some concern and they've already left, and you haven't had a chance to review the paperwork, you're going to have to like call them back in. It gets a little complicated. So certainly being able to, get that information while you're sitting with them is helpful.
Thank you. Yeah, I might send you along so we don't have the counselor yet. It's a job position that's posted. So I might send it along to you to see if you can push it out to, your friends or people or associations that you know of. But yeah, I just want to know from just a best practice as a physical therapist and kind of the lead, at the conservatory right now, can we be able to push a lot of these questionnaires? But yeah.
Yeah, you can. Yeah.
Thank you.
Absolutely. I'm happy to send that out. It is right now. I'll be honest, it is really difficult. There's a number of open positions right now.
Yeah. Yeah. We definitely feel it for sure.
Mm-hmm.
I'm sure you guys are busy.
We're busy. And so, yeah.
Yep.
Hi, my name is Lee Roberts. I'm a physical therapist and I work with Andrea at the Peabody Clinic. So yeah, we're definitely seeing this college age, and I have, 2 teenage children myself. So, the impact of, I loved hearing what you were saying about just this generation. So I feel lucky to be a little bit empowered with information for raising my kids, but it's definitely a concern for this generation hearing your talk today. I'm wondering if there are statistics, just obviously it seems like the sports get maybe programs at college level, at the university level, have maybe a sports psychologist in place. Maybe they don't. I'm kind of curious, like, just what are the statistics on, like, how many sports programs have mental health support at the collegiate level? But then I'd be curious to see then how many performing arts do, and, you know, is this a trend we're seeing? And then my second question is, are you seeing just within your profession, obviously there's more need, are you seeing more people going into this and more providers coming up through the pipeline?
Oh, wonderful questions, and thank you for your comments. So one is certainly Division I level. We're seeing many more positions open up across the landscape, right, where they have somebody hired on staff to provide this care. The NCAA, so this is different than the performing arts world, but so the National Collegiate Athletic Association mandates, right, if you have an athletic program, you have to have mental health support at the Division I level. Like you can't have a program and not have that resource established. So they kind of forced it on Division I athletics. So we are seeing a lot of positions. Sometimes those positions are within counseling centers that they've established like an official liaison. And so a lot of people are managing it in very different ways. It's not always a singular provider working in an athletic department. Amongst Division II and III, the legislation is a little different, but it still requires that there is a liaison. So the challenge there is that, you may, I think about my own alma mater, right? So I know what's going on there, and it's a small Division III school where they have 1.5, right, counselors total for the whole student population. And so, yes, they have somebody who's like the liaison, but they can't provide any extra resources to the athletes. It's just that they've been named as liaison to like identify that is the person you refer to if you have any, challenges, because Division III level, essentially, whether you're an athlete or non-athlete, like, you're just considered a member of the community. So the numbers are growing. I can tell you within the Patriot League, which is the league the Naval Academy is in, which has, I don't know, maybe 8 or 9 schools or something to that effect. When I first came in as a sports psychologist at the Naval Academy, I think I was the only one. And now I think everybody has somebody. So Holy Cross has a provider, Loyola has a provider, Lehigh has a provider and an intern. Lafayette, I actually don't know. American actually has a position open. So sorry, your position is open against American University out there. Right, so as you just heard, everybody now has one or is hiring. A lot of them are hiring for master's level. They don't have the funding for a doctoral level person, which is one of the reasons a lot of positions are open and kind of staying open. Because a lot of us who are really interested in working in specific areas end up with doctorates. So, want to be, I think, probably compensated as doctorates, which is just a little bit of a higher pay scale, which I think makes it difficult. So there's a lot more access to care. There are a lot of positions that are open. There are, people going into the field for sure. There's actually been a push in the NCAA, even out of our diverse student athlete task force. Specifically, there was a push for creating providers of color specifically, and then some resources given so that we have more Black and brown providers, because right now providers are mostly white and female, which for many populations is not, you want to have you have a diverse student population, you want to have a diverse provider population as well. So yeah, there's a push to get more people in, but it's slow going. Yeah, I mean, in the community, right, I think if those of you who are working in the community, right, like if you want to make a referral, you're waiting for 5 weeks. It's not uncommon. So thanks for the question. I know I'm probably at my time.
Thank you very much.
Anything else?
Anything else? All right, Jess, thank you so much. This was absolutely fabulous. And we record all of these and have them available for review and sharing if anybody has somebody that wasn't able to be on this morning, and they can, at least listen and go through as well. And again, I'm happy to send you a copy as well if you'd like it. for future reference at some point. Whether you decide now or later, that's perfectly fine. But we really appreciate your time and expertise, and enjoy your time in Miami before you head back up north to the cold.
Yes, thank you. I will do. I appreciate it. Nice to meet everybody.